Winley. You can call me Dr. D. And today we're going to be talking about everything you need to know regarding your first consultation with a new therapist. All right, let's get started. What is the purpose of a consultation? So this is a very unique opportunity for you to work with a therapist and to ask them specific questions about your needs and then also about what they can offer. I say it's unique because when you actually get into a traditional session, that's the therapist asking the client questions, right? And there's ever really rarely time for the client to ask the therapist questions. So this is that unique space that you get to ask very specific things that you might want to expand on based off of what you read on the therapist's bio, and what you want to know more about as far as their specialties go. And so take some time, fill up the space. And so these are some of the questions that I want you to go into the consultation prepared to ask. So number one, what is your area of expertise? That is a question that we often overlook. Sometimes people have shared like this might be a little too personal, or like I don't know if I can ask that until later. No, definitely bring that into the consultation. You have read, some sort of background on their bio or in their website or wherever you found them, and you definitely have an opportunity to expand upon that, right? And get clarity about some of the things that you don't understand, right? So let's say that they've had this cognitive behavioral training. Ask about that, right? What did you learn? Is there anything specific that you do when you use CBT, which is short for the cognitive behavioral therapy, in your approach? How does cognitive behavioral therapy work with children in particular, right? So you can ask these specific questions so that you can have an idea of how the therapist might approach that specifically with you. So ask what that therapist's specialty is, ask them how that relates to different populations that they've served, and then you'll get an idea of how that might be applied to you in their work with you. So next, I want you all to ask, what do the letters behind your name mean? Right? So there are so many different therapists out there, psychotherapists, counselors, right? Who've been trained again in different orientations, and you have the right to ask, what does it mean? I am an LMFT. That stands for a licensed marriage and family therapist. I have plenty of colleagues who are LCPCs or LMSWs or I don't know, there's just so many of them, right? And so you can ask for them to specify what that means. And usually all of us, we provide talk therapy, right? Psychotherapy at the baseline. So we'll be able to listen to you, we'll be able to give you certain skills and teach certain skills and give you certain interventions. And then you have that unique piece, right? When someone is trained in something, that they can offer something in addition to those things. But you definitely want to ask, you have the right to ask, what do those letters mean, right? And then do some research on that as well. Ask some questions about those letters, and then do some research on your own to know more, than they might be able to offer in that like 15-20 minute space. All right, so now that you've asked about the therapist's area of expertise and the letters behind their name, now it's time to ask about their fee of service. So one of the things you want to ask in this space is, what type of insurance do they take? Now, this is super important to ask these questions during this consultation, because let's say you go ahead and schedule your first session and then you didn't talk about what to expect until the actual session, and you're billed a fee that you cannot afford, right? So to be able to avoid that, you want to ask in advance and talk about the insurance panel that the therapist is on. So they may or may not be in your insurance network, but you can double check by calling the number on the back of your insurance card, or go to the insurance's website and see if they populate through the network provider list. And if neither of those things work, you can ask directly to the therapist, what type of insurance do they take? They give you a list. Most therapists might be paneled on one or two, but they'll give you their answer. And if you are not paneled, or the therapist is not paneled where the client has the insurance, then you can ask them about their self-pay rate. Usually that's really hard and not necessarily affordable for the average person. And that's not always true. I shouldn't say it like that, but it could be something that you're like, oh, look, I'd rather use my insurance, right? And so if you cannot afford the self-pay rate, then you can choose to ask about a sliding scale fee or a payment plan. Sometimes we stop at, oh, they're not a part of my insurance and that's it. But just check them out. Another question you might consider asking a therapist is, have they ever treated this presenting concern before, and what were the outcomes? If there's anything that they can give you in advance of treating, this concern, that could be really helpful for you, right? So you can know maybe like the duration, how long it will be, do you have to come into therapy weekly or bi-weekly? Do you have any specific insights on how you go about treating this presenting concern, and how has that been with other clients, right? So just getting some exposure to their approach. This is also another lens for you to see and maybe ask questions about how they have approached a certain concern, and then if there's anything that you would like for them to do more of or less of, you could talk about that. So really getting a unique view of the therapist's style and how they approach the concern that they'll be working with you. Sometimes therapists or clients might want to ask more about, are you a type of therapist that's going to give me feedback? Are you going to give me homework? Are you going to give me exercises? Are you someone who just listens and just kind of goes off of how I lead? Usually as a therapist, I like to share upfront my style, what I expect, and kind of how I maneuver therapy in sessions, and what I'm hoping the client can do as well. But you have different therapists, so you can ask a little bit more questions about their approach to the presenting concern, and then you have an idea, especially if you're working with a specific issue, treating addiction or treating, working with couples therapy. Like, we all have our different styles on how we might approach those things. So it's really important for you to take some time to ask about their approach, and then what the outcomes have been with previous clients. Now, the last thing I want you to consider is asking about the therapist's availability. It is so annoying when we get to a place where we both feel connected, the therapist and the client, and then we realize we don't have any availability. There's nothing that matches in either of our schedules, and so we therefore can't move forward. So I would highly suggest during your consultation to learn a little bit about the days that the therapist works, the types of schedule they have. They might only work mornings, they might only work evenings, just getting an idea. Do they work on the weekends? Get an idea and learn a little bit about what to expect before you sign up for that first session. Thank y'all for listening. I hope that this was inspiring or answered some of your questions in some capacity. Now, if you have any other questions, definitely feel free to comment them or direct message me. I would love to hear other questions that you have. Again, this is Q&A with Dr. Winley, so please let me know what other questions you would like to learn about regarding therapy. All right, until next time, bye. One look, and